No, Colm, Deputy Colm
You hear, like, it's a shocking thing
10 minutes.
to lose a child, and we all hope, I suppose we all hope to end our days without having to endure that loss, that awful loss. And I'd like to take this opportunity to sympathise with the families, the parents of the babies who died in the Midland Regional Hospital. And I want to offer to the sympathies to their family, to their broader families, and to their friends. Look, parents suffering such a tragedy deserve to be treated with sensitivity and respect, and they also deserve to know the truth, however uncomfortable that truth may be to the hospital, to the HSE, to the Department of Health, to this House. Look, their treatment after a loss of a baby was deplorable, and it was made much worse with respect to the response of government, the department, on the issue of the delay in publishing reports around the incident. And the minister was foot-dragging. You didn't face the truth when you had it, and you have a serious clinical management breakdown, and failures have been identified in reports, and that has added insult to injury. Look, often tragedies as such offer some comfort, maybe a small comfort, to give somebody that is grieving an opportunity to protect somebody out there who may become vulnerable of the failures of the system, and to prevent another family enduring that type of pain. And the actions and the inactions of the Minister and his department, the Cabinet, the HSE, you've robbed people of that opportunity to avoid that pain. And Portlaoise Hospital, no thanks to the political interference, what's going on, as Deputy Kelleher has said, with respect to current Minister Flanagan, maintaining a level 3 status, a status without resources. Level 3 without the appropriate level of resources. It may have looked well in the print media locally, but the reality is that we see a situation now where level 3 status was provided, but not the resources that were underpinned and required to ensure a successful delivery of services. And I suppose, Keaveney, what we want to know is that the hospital, we know it wasn't governed, it wasn't resourced, it was ill-equipped, it wasn't in position to provide for a safe delivery of services in terms of clinical requirements that will be provided in a status 3. But what we do now know, it was simply a fiction and a failure politically to deliver the matched resources that were announced, and now we have a situation where we are now found out. And we have to stop in this House playing with the well-being and the lives for the sake of political expediency. A level 3 status without resources, that was expedient, and it cannot be repeated again. And I think that the government, it needs to apologise. It needs to apologise in unison. You know, the risks that were associated with that activity, political interference to protect a status without resources, it has damaged the trust, it has created a cynicism in politics, and, you know, the citizen in that community, they are raising questions with respect to the role of the HSE, the role of politics, and people in that area have every right to be cynical. Minister, the HSE is presently conducting a review of maternity services throughout the country, and it's something to akin to a chapter in Animal Farm, where all reviews are equal, but some reviews are more equal than others. And I'd like to raise with you one hospital that is receiving some focus, some attention, and that's Portlaoise and Ballinasloe. And I think that it was unfairly treated with respect to the leaking of information. It may not be strategically, electorally of interest to the government, but it is to the people of Ballinasloe, because those people who live in that area are dependent on the service, they're dependent on the hospital, dependent on their accident and emergency. And we've already have a situation where that community has experienced the closure of a psychiatric inpatient service. And that followed a review similar to that has taken place across the country. And we were told that we would have a better service, a better psychiatric service in the context of the centralisation of services at GUH. And we now know today that staff are taking industrial action as a consequence of serious issues at that unit. And nurses are expressing concerns about the workload, and unfortunately what we're seeing is that their concerns, the concerns of the front line, like the concerns of the front line in Portlaoise, they were ignored. And we have a situation where management are living in an environment looking at lack of resources on the front line, like what had happened in Portarlington. And we don't see a situation where we're progressing services on the front line to a satisfactory and safe level. Minister, I want to say that that situation has not been helped by staff shortages, an underspend where resources are sent back to the central exchequer, and we see a situation where these shortages are compounding the incapacity of the front line of care across services, a failure to deliver and protect the most vulnerable people. And Minister, there was great hope with your appointment that you would address that situation. When you look at for example, the physical structures at the psychiatric services in GUH, a unit that's leaking, creaking, subsidising, falling in ceiling, poor toilets, and the contrast to a €3.2 million, the only ligature-free facility in this country, lying idle. It was a political interference. And that's what happened to Ballinasloe. And that's what happened to Portarlington in the Midlands. And it's disgraceful. It's a disgraceful situation. And it's indicative of the government's failed and flawed policy in this area with respect to the rollout of primary care in particular, but also in the context of psychiatric services. And Minister, I fear that, you will hesitate to intervene, to directly intervene with the resources that are required. And we need to see a situation where the damage that has been done at the public relations disaster that exists within the Midlands, and for women across this country, that they can have faith, confidence with respect to maternity services. And there is little wonder that people who are protesting about the closure of maternity services across this country, such as Portlaoise, simply do not trust the HSE because their experience and the experience of communities across this country has been pretty awful with respect to how the HSE roll out their reviews. Minister, I'm sure you will agree patient safety will be prioritised, and that will be supported in this side of the House. We need to see a review of management and management practices, and I am surprised that we have not ensured the greatest form of contemporary governance to address the situation at that facility. And most important, Minister, the HSE must be brought in to understand that they have to take responsibility, a responsibility for the improvements, a responsibility with respect to accepting criticism, a responsibility for delivering a modern public service in the context of maternity. And senior managers have to become accountable and to report back and to accept liability and to accept blame and to accept responsibilities. Thank you, Chairperson.
Thank you.